All right, let's dive straight into this explainer covering the 2026 locum tenens data benchmarks. You know, it's a funny thing. If you were to go out right now and ask 10 different locum physicians what they earn, I guarantee you're going to get 10 completely different answers. And it's not because the market is totally random or anything like that. It's actually because your specialty is, without a doubt, the single biggest variable in locum tenens compensation.
Think about this for a second. The data shows us a really fascinating comparison. You could have a radiologist and a family medicine doc working the exact same number of hours, physically located in the exact same state, and even booking through the exact same agency, but they are bringing home completely different paychecks. Today, we're going to unpack exactly why that happens.
Because, honestly, the pay spread across these specialties, it is not subtle at all. On the lower end of the locum market, family medicine is running roughly $120 to $185 an hour. But then you look at the high end. Things like in-person radiology and anesthesiology are easily clearing over $450 an hour. Figuring out exactly where your specialty sits on this spectrum, and more importantly, why it sits there, is absolutely crucial. It's the whole foundation of your compensation strategy.
Okay, but before we jump right into the actual rankings, we need to talk about what's actually pulling the levers here. What drives these locum pay premiums? Well, there are three specific factors that explain why some specialties can demand such dramatically higher rates.
First up, shortage. This is basic supply and demand, right? Specialties that have a persistent, nationwide shortage of doctors give locums a massive amount of structural leverage. Second, procedural complexity. If a specialty requires highly technical, hands-on skills that you just can't easily outsource or replace, well, they command a serious procedure-based premium. And third, call burden. If you're dealing with significant on-call obligations, that disruption to your life gets priced directly into your hourly rate, or at least it definitely should be.
So, keep those three big drivers in your back pocket as we work through the source benchmarks. Let's kick things off with Tier 1, the absolute highest paying specialties. The data paints a pretty clear picture here, with radiology completely leading the market. In-person diagnostic and interventional radiology is pulling in $330 to $520 an hour. And why? It's driven by a massive nationwide imaging backlog, combined with a structural radiologist shortage that's been going on for years now. Anesthesiology is right there behind it at $325 to over $450 an hour. There's a really complex dynamic playing out there with CRNA scope of practice expanding in a lot of states. Basically, facilities desperately need physician anesthesiologists for supervision requirements, while simultaneously trying to expand their CRNA-led care.
Rounding out this top tier, we have neurosurgery and interventional cardiology. Both of these are driven by just extreme procedural complexity and a really heavy call burden. In fact, that call burden means they floor out at around $300 an hour, even for standard run-of-the-mill assignments.
Actually, quick timeout before we drop down to the next tier. We need to make a really critical note about CRNAs specifically. That $220 to $285 range, that reflects 1099 independent practice rates. W-2 CRNA's locum setups are structured totally differently. Always confirm your contract structure before you start comparing rates.
All right, let's step it down one level to Tier 2, the high-demand surgical and procedural specialties.
In this bracket, general surgery is running $218 to $335 an hour. But here's the kicker, if you're willing to take rural and critical access hospital assignments, you're hitting the absolute top of that range. That's entirely due to the intense call burden and the acute shortage of general surgeons willing to cover those rural markets. Then we've got orthopedic surgery sitting comfortably at $250 to $380. With aging population demographics, the sustained demand there shows literally no sign of slowing down. And gastroenterology, they're earning their premium through endoscopy procedural volume. A GI doc generating direct procedural revenue is always going to command a very different rate than a purely cognitive specialist.
Finishing up this category, urology and non-invasive cardiology round out Tier 2. For both of these, it really comes down to those shortage dynamics we talked about earlier, combined with the serious complexity of the patient populations they're managing.
Moving right along, we arrive at Tier 3, high-demand cognitive and shortage specialties. Let's see what the numbers are telling us here.
Emergency medicine is super unique in this tier because it's shift-based. No call, completely clean boundaries, you know exactly when you're working. Rates here are running $200 to well over $350 an hour, and that premium isn't really driven by a structural shortage per se, but rather burnout-related turnover that just creates a persistent flow of open shifts. Psychiatry is sitting at $185 to $265. And guys, it is arguably the most undersupplied specialty in the entire country right now, relative to demand.
Behavioral health access is basically at a crisis level in most states, giving locum psychiatrists structural leverage that very few other specialties can even dream of matching. Neurology sits firmly in this tier too, driven by really similar shortage and complexity factors.
Next up are the hospitalists, running 160 to 250 plus an hour. Though, keep in mind, that ceiling specifically applies to the heavy lifters, rural nocturnalists, and high-acuity ICU-heavy roles. You'll also see infectious disease anchoring the lower end of this tier, largely due to demand that has stubbornly persisted post-pandemic.
But honestly, psychiatry deserves its own special spotlight for 2026. It is one of the very few specialties where telehealth delivery is just widely, universally accepted by facilities. This means a psychiatrist with a single state license can cover multiple markets completely remotely. For locum psychiatrists who are open to hybrid or fully remote setups, this absolutely transforms the income math. Think about it. Way lower travel overhead equals a much higher effective hourly yield. It's fantastic.
Okay, let's keep this moving and jump into Tier 4, primary care and mid-range specialties.
Now, in this tier, the demand is definitely high, but the rates are a bit more moderated overall. That being said, look at OBGYN. They are really punching above their tier class here at $175 to $260 an hour. That's entirely due to the extreme complexity and the liability involved with delivery coverage in rural markets. We also see internal medicine and pediatrics grouped in here, heavily driven by chronic disease management and some serious rural shortages, respectively.
The benchmark data for this tier perfectly illustrates how procedure mix changes the game. Dermatology earns a solid premium over other primary care specialties purely because of that procedure mix. A dermatologist doing cosmetic and surgical procedures is just generating a totally different revenue profile than a purely cognitive specialist. Meanwhile, family medicine is anchoring the lower end of the whole locum market at $120 to $185 an hour, and it's definitely not because demand is low. Demand is actually huge, but the supply of family medicine physicians who are willing to do locum work is also the highest of any specialty out there, which naturally cools the rates down.
Of course, we can't forget about advanced practice providers. NPs and PAs operate in this parallel locum market that also sees a ton of meaningful variation depending on the specialty. Let's check it out.
Primary care NP and PA roles are pulling in about $70 to $95 an hour at the baseline. But look at emergency medicine. NPs and PAs there command $85 to over $160 an hour. The shift-based structure and the acuity premium in the ER perfectly mirror what we see in the physician market.
And following that exact same logic, psychiatric NPs are sitting at $100 to $150 an hour. It reflects the exact same shortage dynamics we just talked about with their physician counterparts. The really crucial takeaway here, if you're an APP considering locum work, your highest yield entry points are almost always going to be emergency medicine, urgent care, or psychiatry. Primary care rates are just a bit too compressed by comparison.
So what do we actually do with all this information? Well, the source material lays out a really practical 3-part playbook. Step 1, know your floor before you even speak to a recruiter. Use the specialty range we just went over as your anchor. That floor number, that is the absolute lowest you should ever go. The ceiling is your target. Step 2, cross-specialty awareness. If you happen to have training or certification across multiple specialties, the rate difference between them is real tangible money. Don't leave it on the table. And Step 3, track market moves. These rates are living, breathing things. Going into 2026, the specialties seeing the most sustained upward pressure are psychiatry and radiology.
Which brings us to this absolute strategic gem from the report. The specialty rate range tells you what the market is willing to pay, but your personal rate floor tells you what you need. That little space between those two numbers, that is your negotiating room. Know both of those numbers cold before you ever pick up the phone. It's a fundamental mindset shift, and it completely puts the power back in your hands. Just to wrap everything up, I want to remind you that the Healthcare Pay Index publishes fully independent pay data for travel nurses and locum physicians. There's zero agency funding, absolutely no recruiting incentives, and no conflicts of interest here. If you want to dive deeper, the full specialty pay guide is linked for you to explore. So, why does going through all these numbers matter so much? Because knowing the actual hard data is your ultimate leverage. The real question is, what is your next contract going to look like, now that you finally know your true market value? Thanks so much for joining me as we explored the data in today's Explainer. I'll catch you next time.